Welcome everyone to the August AAC Purchasing Practices webinar, Inclusive Community Health Challenges. I am Rebecca Trout, the Director of the Awards Program here at the National Civic League. The National Civic League is a 125-year-old nonprofit that aims at civic engagement to create equitable, thriving communities. The All-America City Award, as many of you know, is our flagship program. It began in 1849 to recognize exceptional civic engagement and local government. We are actually now accepting applications and letters of intent for the 2020 All-America City Awards. In 2020, we will recognize 10 communities as All-America Cities civic engagement work that has fostered health and well-being in communities. To win, each community must demonstrate innovation, impact, equity, inclusiveness, civic engagement, and cross-sector collaboration. They do this by describing 3 successful efforts that are addressing pressing local challenges over the topic of health and well-being this year. I'll be sending additional information for those of you who are interested in applying for this year's award. That will be sent in a post-webinar email that will also include the slides and recording. Please note that the date is moved forward for this year's award, so letters of intent for this year are due November 1st, and applications are due February 19th. And while we do celebrate the great work of civic engagement through the AAC program, we also aim to share those innovative practices from applications through avenues such as this monthly webinar series. Today we'll be hearing from our 2019 All-America Cities about the community health challenges that they undertook. First, we will be joined by Angela Stewart from the Battle Creek Community Foundation, and she will be speaking about Battle Creek's and Calhoun County's Operation Fit project. Following Angela, we will be joined by Jasmine Carr, who will talk about Lancaster, Texas's experience with the It's Texas Community Health Challenge. We will have some time for questions at the end. Please submit those via the chat box, and I will have the presenter address those after both of them have had a So now, without further ado, Angela, the floor is yours if you want to begin sharing your screen.
Thank you. We'll pull that up. Okay, and Rebecca, thank you for having me today. I'm going to talk about Operation Fit, which is our school-based wellness program that we have in our schools within Battle Creek and throughout Calhoun County. And so to cover Operation Fit, I'll be explaining what Operation Fit is, some of our basics that we follow through the program, and then give you a little more detail about 2018 and 2019. So Operation Fit is a healthy community initiative of Bronson Battle Creek, the Battle Creek Community Foundation, and the Battle Creek Family YMCA. So our goal for Operation Fit is to decrease childhood obesity in Calhoun County, and we did that through that partnership. We came together through the Regional Health Alliance, which is a community collaborative around health, and they came up with this program. And so the 3 aspects of Operation Fit in our schools is to really focus on increasing physical activity, mainly through the school day, but also to promote some additional physical activity when the kids go home and their families. We'll talk about some strategies of how we do that. Also to improve the nutrition and lunchroom environment. This is one that's a little bit different because normally we hear about improving nutrition, but we're talking about the environment. So what can we be doing differently the cafeteria that promotes kids making healthier choices, because we already have school food guidelines, but they still have a little bit of choice that's involved there in the lunchroom. So how can we kind of provoke them to get to a healthy choice? And then also focus support systems. So we know that we can't just be doing it in the school. This also needs to translate to the community and into their homes. We look at policies, practices, and then also how we get parents and teachers involved in the effort. I wanted to share a little bit about our path because we didn't just come up with Operation Fit overnight and implement it the next day in the schools. We definitely had quite a path to get there, and we worked with Bronson Battle Creek, our local hospital, and their grant-making board, which is called Community Partners. The first year of what we now call Operation Fit, they had asked us to come up with a program that would be a short-term activity-focused program where we would get kids active. So the Feeling Good Mileage Club was piloted in one of the schools in 2012. From there, we learned that we weren't really going to impact childhood obesity with a 6-week program that was a walking program that just had a start and end date without looking at the whole child and how we worked throughout the entire year. So they had us go and look at how do we make a greater impact. So that's when we brought together through the Regional Health Alliance a childhood obesity planning group. We did quite a bit of research through that group. We had special speakers that came in town. We went on different visits, as well as just trying to find experts throughout the country that we could really talk about what they're doing and how we could expand some of that work. So that is how we came up with Operation Fit. Many times people ask us if we are a research-based initiative, which we have a lot of research-based pieces of our initiative, but we decided to do a toolbox type of approach where we picked up pieces of things to put them together so we really could look at the entire culture of our schools. So we launched that in 2 schools, so connecting with other initiatives that were going on in town, including breakfast in the classroom, which was a way to have breakfast for kids while they were starting to learn, but it also helped us to improve some activities prior to them going into the classroom, so we had a little bit more time. And we also changed the Feeling Good Mileage Club into Operation Fit Mileage Club, and we expanded that as we learned more. So you'll see kind of the evolution through those years to where we are now and how we've expanded schools and districts. So we went from a pilot program really testing some things out into our full program that you see today. From 2014 and 2018, we've really had some great successes with our program. We've had significant improvement in physical testing, which I'll show some of the data around all of these. Also, self-reported exercise and eating habits for the students. So we know that it might not be that the students are actually practicing these activities on a regular basis, but we at least know that they know the right answer from when they started school to the end of school. So there is some education that's taken place. And then they are stating that they have some healthier behaviors. And we continue to find ways that we can monitor that and other ways we can measure to see if that's actually taking place. As well as we have parents that are reporting better health and classroom performance of their students after starting Operation Fit in these schools. And then you'll also see our mileage club that has stayed that consistent piece throughout our program, and we've been able to serve about 20 schools per year with an average mileage of 7.47 miles per student that takes part in the program. So some of the aspects of Operation Fit, and we'll go a little bit deeper into some of these, but we really serve as a backbone support system in the schools. So we have staff that go out into the districts. We have one district lead for each of the 2 districts that we're very involved in, as well as coordinators that are at the school level and in the buildings on a regular basis to help with implementation. We do this because we know that health is important to our schools, but sometimes it's not going to end up first on their priority list when they're looking at these other aspects that include student success. So we do a lot of grant writing support with our schools and help them to write those on their behalf so that we can get some additional resources into the schools, because those health grants for schools must be paid out directly to the school, and we can't have it paid out to our program. So if you're looking at funding options, that's where we partner with the schools very closely so that they can receive the funds and we just help them in acquiring those and then distributing them into the school. Also do things such as morning movement, which is one of our most popular pieces of Operation Fit and the one that folks recognize the most, where kids are getting active for about 5 to 10 minutes before they even enter the school building. And this looks a little bit different based on the needs of each of the schools. We have some schools that create one big gathering of all their students in one place and do morning movement there, and we have other schools that it's at the teacher level, so each teacher is doing morning movement with their students. But we need to set aside that time and make sure we get the commitment from everyone involved that morning movement is taking place so that the kids are able to start their day properly. We also continue to do breakfast in the classroom with the food directors. It's a great program for them, but it also allows for that time for that morning movement, as well as making sure that all the kids have the option to eat breakfast in the morning. And we also do active recess. And active recess is really about how do we set up recess so that all kids can be active throughout that 15 to 20 minutes that they have. So we don't want them going out there and trying to figure out for 5 to 10 minutes what are they going to do, or kind of standing around. We want them to have options that are very clearly laid out for them so that if they don't have something that they go to automatically, we can teach them games. We have different challenges for them. It might be how many times they can hula hoop, or how many times they can jump rope in a row. And our staff that are out on the playground, including the recess supervisors from the schools, are trained on how to keep kids active throughout the recess time, because it's really what the goal is of that time. And then I mentioned the lunchroom environment. So we have taken a lot of the aspects from Smarter Lunchrooms of how we can improve the lunchroom environment. So we look at placement of the food to make sure that it's in a place where kids are more likely to grab it. So it's not always about removing something from the lunch line. We look at white milk versus chocolate milk and how do you place the white milk closer so that kids are more likely to grab the white milk versus the chocolate milk that might be just a little bit further reach away. And the data shows that kids will actually make those healthier options if they're the more accessible options. It also talks about how do we set up the lunchroom to be a more welcoming, calm environment for kids to be able to focus on eating. So we've had schools that have dimmed the lighting, they might play some soft music, and they also present the food in a very different way. So you might want nicer bowls for fruit to be in, where it just looks a little more appetizing. And we also, with that nutrition component, have our hospital that puts on cooking demonstrations in all of our schools. Actually, all 20 of our Mileage Club schools will participate in one of those cooking demos where the cooks and the nutritionists from the hospital will come in and present and on a recipe and share with students and their how they could make that recipe at home. So that's kind of a quick run through of some of the things that we do, but we'll get a little more depth into some of those other components. One of our newer partnerships is with the Food Corps, and they have 2 coordinators that they have assigned to our Operation Fit schools that work with us and are in the buildings on a regular basis. We partnered with them because it just made sense with what their mission was of really to promote healthy eating with our students versus what our mission is around improving that lunchroom and nutrition environment, as well as the physical activity so that we can reduce childhood obesity in the county. So it just ended up being a great partnership between the 2 organizations, and they have brought in a lot of knowledge and training around nutrition for our staff as well. We also recently piloted Tower Gardens. So this was a really fun one that actually the food directors ended up bringing to us in one of the schools, because what was happening is that they had resources to be able to put in these tower gardens that could go throughout the school and travel from classroom to classroom for the kids to interact with, but they were having a hard time getting teachers to sign up to administer this program. So when they came to us and said, hey, we have these resources, we jumped on it, and our Operation Fit staff were able to share this, and now it's become such a favorite in the schools that the kids can watch these different plants grow and just really interact with it, where it wouldn't have happened without having that other kind of coordinator in the building that can help to support the school in these efforts. We also provide a lot of information out to not only our building staff, but also community members about Operation Fit and what's been happening in the school, and also some ideas and tidbits of how they can incorporate some of these different ideas to their home. Another highlight that we've been incorporating our staff wellness teams. So from one of our early surveys, we heard a lot from, Operation Fit is a great program for the kids, but how do we continue that message, and how do we be great role models for what's going on with our students? So the staff got involved, and they put together staff wellness teams that are facilitated by our Operation Fit staff, and they work with them on different staff challenges that they select a year. And one of the biggest components that those staff wellness teams do is they take the HSAT test, which is a Healthy School Action Tool, and they use that to create action plans of how they can improve things within their buildings. So that's really important when we're talking about having a really clear, goal-oriented action plan to improve schools around health and wellness, as well as how do we kind of gauge where we're at the end of the year. So it gives us a little bit of a scoring system with our schools as well, and it's also what the state school wellness programs use to identify schools that are in either a gold, silver, or bronze level with their work. Another piece that's been extremely important that we've done since the beginning of our program is to include students in the decision-making when it comes to what's happening in their schools and how we implement the Operation Fit program. As you kind of probably noticed, is that Operation Fit is not the same in every school. We talk about a lot of different initiatives, but the student wellness team really helps us to select what ones are going to be most important when we're going into a school, and where can they really champion what's happening. So once a month, they get to work on different areas of the planned events, cooking lessons. They make posters for the cafeteria, which goes along with our Smarter Lunchrooms model that we use to really promote healthy eating in the cafeteria. They've done things such as put together thank you cards for the different activities that take place, and also they help with the monthly tastings that we'll get to in just a moment, but are really important when kids get to taste that might be on their lunchroom or on their lunch table. The other thing that they were able to do is go to a field trip to Family Fair, which is one of our local grocery stores. So they've really been ingrained into our program and become a really good resource for our program as well to find out what the kids are really thinking. Another piece that was definitely an evolution of the program was our food cart component. So we started testing this with one school when they said they would like to get more fruits and vegetables into the hands of their families. And what we first piloted was once a week we had a farmer's market at the school. And what we were finding was that the families that were coming and trying to pick up, they could pick up like one cucumber or one tomato, and they weren't really able to buy much more of that from the small farmer's market that we had. So we started kind of reaching out across the community, trying to find who the right partner was. We started with a food bank, thinking that they might be able to provide us with some healthy food, and it was even very difficult for them to provide the food that we were looking for on a regular basis. So what we asked of them is that all the food that's on the cart have to fit the National School Food Guidelines. So as we started having more and more conversations, we found this to be really difficult. And then we had someone reach out to us from the local casino that does a lot of work in food, and said they wanted to get involved in some way because they thought that our efforts seemed aligned with what they were hoping to do, some of their food work. And they partnered with us starting in 2017, and they distribute food to us once a week that we are able to bag up and give out to the kids, and it's all fresh fruits and produce, and anything that is some type of healthy snack has to fit the National School Food Guidelines. So it might be a small box of raisins. They found really healthy granola bars that could be sat home with the kids, but there were options for to be able to have a bag of some fresh produce that they could test out. And then we've also started to incorporate some recipes along with those so that they can not only get them, they also will know what exactly to do with them once they have them if it's something that's new. And so the casino has been a great part for us in implementing that program. So the next piece are the things that I mentioned. So Operation Fit organizes and implements monthly tastings at all of the 6 schools where the full program is implemented. And at those schools, we work with those food directors to select what the tasting is going to be. And these are items that could possibly end up on the menu in the future. So they try out these different pieces, and then the kids to vote on what they like the most. So normally there's a couple things that they're trying so that they can go if they want one of those things on the menu in the future. So there's been some really fun ones that they get to try out. The smoothies are popular, and surprisingly enough, the kale chip also ended up being pretty popular with the kids. So they'll see some of those things up on the menu later on and recognize them once they're there. So they're a little more willing to try them because they tried a small taste of them during the tasting. From our program, we've been able to work with the state and really share what we've been doing. And so you'll just see on here some of our awards that we've received over the last few years. And these are really awards that our schools have received. We've worked with them using that HSAT that I mentioned before to identify where they're at and what they reach by the end of the school year, and they turn into the state. And so we've been pretty successful with getting them from that where we had quite a few bronze in our first year into we're seeing more and more gold as we move forward. And then we've also been really humbled by some of the other awards that have reached out to us with Brightest and Wellness in the state of Michigan, as well as the Governor's Fitness Award that has acknowledged some of the work that we've been doing. So not only have we been able to experience those events at a really fun level, but we've also had some really fun events at our local level where we've introduced more and more into the community about what we're doing with Operation Fit. So family fitness nights are a popular thing where the Y Center is able to bring kids and their families into the Y Center for a night, and they have different activities set up for them. Apple Crunch Day is a really big day, especially in Michigan with apples being so popular, and it's where all the kids bite into an apple at the same time. So they get to have a little bit of fun with food with that. One that I always love to highlight is the candy drive. So as many know about Operation Fit is that we try to limit the amount of sugar intake that kids are having, but we know Halloween is a really difficult time to do that. So we work with the schools on doing a candy drive. And this helps with not only Operation Fit and limiting the sugar intake, but it also has the philanthropic side that we really want to encourage for youth to just kind of dabble in, being from the community foundation. And so after Halloween, they're able to donate as much candy from their Halloween bags as possible, or as much as they would like. And then the candy drive, they kind of score against the other classrooms in their building, and we always have a winner. But then that is donated to our local VA hospital and distributed amongst the the floors there, and the kids get really excited about it because it's something that is their own, that they get to go and give to other people. So it's a fun activity for them. They also get to write cards to the veterans, and it's right before Veterans Day, so they really get to connect those things together. And so for our data, you'll see all 6 of our schools' evaluation scores have increased. We always do an evaluation with them before and after of how they're doing with Operation FIT and what we're trying to implement. So we have a scoring chart that we use with them. You'll also see in the next couple slides how we've improved with our physical testing, the student exercise and eating habits, and our teacher support. So for our physical testing, we use the paper test, which is similar to a shuttle run. And over the years, we continue to improve those scores. And these are not all the same students. We see a change in students as they either get older or as buildings change. So we started with that 65% that improved, and we're now at an 89% of student improvement with their physical testing. Also see improvement with their self-reporting. As I said before, we're not sure if all the kids are doing everything that they say that they're doing here, but they at least now know the right answers from what they did at the beginning of the school year. So they're getting at least the education component of this. So 19% increase kids eating fruits and vegetables for snacks. They reported 16% increase in their after school, as well as 18% increase in kids eating 4 or more fruits and vegetables a day. And then we also saw a reduction in screen time, which is always a positive because we want kids to be active and not sedentary. We also get great feedback from our teachers. They're positive about morning movement as well as brain breaks, which are just little breaks throughout the day where kids are active for a minute or two and then they get back to learning, as well as some of the indoor recess components that we put together along with active recess to try to keep kids active while they're inside, not only out on the playground. And they also report that their students are more focused after movement. One thing that you'll see interesting on this screen is about the teachers participating in morning movement. So it's at 75%. We would love to have that at 100%, because what we see with our buildings, because not every building does the program the same, is that the schools that have 100% teacher involvement in morning movement are the most successful, because the kids see it as my teacher's out there, this is important, or I'm expected to be a part of this, and so you see a lot more activity from the kids during morning movement when their teachers are out there being great role models for this. And then we also have really good feedback from our parents. They're familiar with the program, they understand the components, and they also say that their kids are excited about Operation FIT. So you'll see some of the quotes there. The red bags are our food cart bags that go out on a weekly basis. We get a lot of questions about expanding to other schools, and we make decisions about expanding to other schools based on what our funding is, as well as if the school is ready, because there's a lot that goes into Operation FIT, and we ask a lot of our schools on how they're involved. And so if they're not going to be as committed as what our staff is, then it might not be the right fit yet. And we look at other things that they might want to do on a smaller scale, and we'll always provide support around them looking at filling out their HSAT, and we have staff that will go and support them in that way. But to implement our full program, we need at least their leadership on board so that we bring the whole school along. And then this is just a highlight of our mileage club that I mentioned before. Is in about 20 of our schools. This year we had 21 participating schools with a little over 6,000 students, and so an average of 7.3 miles per student. We're able to implement this because we do use scan card technology, so you don't have to have many staff out there. When we first started the program, we had staff out there counting laps with kids. And this has really evolved to, it needs to be a scan card technology so that the kids are able to do it, and then you really only need one person in each building that implements the full program. And then Bronson Battle Creek is always a great partner. and they always attend all of the schools and give a cooking demo to every single school in our program. So it was sometimes, every once in a while, we have some scheduling conflicts that makes it a little hard, but the hospital staff are always very accommodating to get this done, and we always get really great feedback from the parents and the kids about the event. So this is just a highlight of the different awards that we've seen throughout the years and those acknowledgments from 2014 when we first started with our pilot program all the way through last school year. That is the end of mine, so I will pass you back off to Rebecca.
Excellent. Thank you so much for that presentation and just know a little bit more about Operation FIT. We do have a couple of that came in through the chat box, but I'm just going to keep those till the end. So for right now, we'll be handing this off to Jasmine, who will be talking about Lancaster, Texas's Community Health Challenge. Jasmine?
Yes, thank you. Pleasure to be one of the presenters today. My name is Jasmine Carr. I am the Community Programs Coordinator for the City of Lancaster, and just wanted to make sure that everyone can view my screen. One second.
Yes, we can. Thank you.
Can everyone see it? Okay, great. Again, my name is Jasmine Carr. I'm the Community Programs Coordinator for the City of Lancaster, and I'm going to be talking to you guys today about our City Health Initiative and also our participation with the It's Time Texas Community Challenge. A little bit overview of where we're going to be going. We're going to talk about the quick facts, our Community Health Initiative, again, our experience and our steps moving forward that our city is taking. If you haven't heard of Lancaster, Texas, just know that we are the shining star of Texas. A lot of you all may know Dallas as a reference here in Texas, and we are about 30 minutes from downtown Dallas. We're located in Dallas, and we have a population of about 38,870 residents. Our Community Health Initiative is a council initiative, and they have really placed it on the forefront. Our goal is to be a healthy, safe, and engaged community, and by doing so, we define that by developing and expanding a community health initiative and also improving our documented health disparities within our community. And we have worked with variety of different professionals to identify those health disparity issues in our community. And the three that remains at the forefront are heart disease, rates of pediatric asthma, and then also low birth weight, And then we have partnered with Best Southwest Partnership, again, Methodist Health Systems and others to identify those in the community. A little bit about, again, our council initiative. They have established a health and fitness council, and that health and fitness council historically includes members from our local school district, our Parks and Rec department, our police department, our emergency medical services, our community relations division, our local Cedar Valley College, local gyms and businesses and hospitals, residents, and community leaders. Our council has also taken several steps to involve legislation as well in making our community a healthy, safe, and engaged community. One highlight is the legislation for the Smoke-Free Texas. We are out of 4 cities in Texas that have signed up for the Smoke-Free Texas, which includes more entire regulations for smoke ordinances that includes both the indoor workplaces and also restaurants. And out of those 104 Texas cities, again, there are about 1,200 cities in Texas, so only 104 Texas cities have on board as of 2008 with the Smoke-Free Texas in order to have tougher regulations and tougher smoke-free ordinances. And then also as well, it's worth mentioning that our council has also made legislation to tackle food deserts in our community by having higher regulations for the amount of variety stores in our community too. So, and of course, we all been waiting for our participation in the It's Time Texas Community Challenge. So the It's Time Texas Community Challenge, it's a nonprofit organization composed of both innovators, opinion leaders, and an army of motivated Texas residents, businesses. Everyone is all excited about our community challenge. It is a 12-week state competition, and our phones start ringing off the hook the closer we get to January, because our residents here in Lancaster know that we typically do participate in the It's Time Texas Community Challenge, and it's definitely something that we look forward to. And the Community Challenge breaks up the cities based on population sizes. We are in the small category, and there's a very small category in medium and large cities. And the winning community receives an $1,800 grant for health initiatives, a trophy, and a city banner, and also a certificate from the governor. And how cities sign up to participate, they do register online through It's Time Texas. And again, they earn points by competing in activities and completing activities. As an individual, they can register their school, their business, their nonprofit organization, and elected officials also lead the charge too. And they earn points by taking healthy selfies, hosting free community health events, and tracking their physical activity. And just a little bit of an in-depth look. This is our city council here, and as you can see, they lead the charge by signing a pledge with their and just really encourage the residents within their district and also businesses in their district to get on board with the It's Time Texas Community Challenge and to help our community to earn points. Here's a little bit of schools that participate. As you can see here in the photos, so one to the right with the sky, we partner with schools to participate in the It's Time Texas Community Challenge. They sign up as a school, get their students, parents, teachers, and even the principals get riled up and involved. You can see that we have a healthy pep rally going on. We invited the radio station to come out and do some physical activities with the students outside, with the teachers. You can see a healthy brunch there that we provided teachers. And we also partner with schools to put on free health fairs as well, in which they invite parents, the students, can really transfer into the home, and not just something they learn at school, but those practices that they can take home and utilize on a daily basis. And the kids are really excited to get their parents to sign up for the community challenge, start tracking their steps, and again, taking those healthy selfies. What teenager do you know now that doesn't like taking pictures? So they take pictures of themselves eating healthy, drinking water, and so forth. And here you see our Senior Life Center. Our seniors were definitely helping to lead the charge in our points that our community was able to earn. You can see our senior citizens here. They are making care packages for members of the community that they haven't seen in a while. And with those, we made healthy care packages, asking them to limit the amount of sugar in those and more fruits, healthy vegetables, and then also their Monday through Friday, they also have a free lunch program for senior community through our Senior Life Center. And you can see there that they were also very excited about taking healthy self themselves, drinking their water, and also eating their vegetables. And here you can see our city staff that got very motivated and involved as well. Our firemen were very popular. They were always ready to take a picture and, again, posting their healthy selfies. The one on the treadmill, Mrs. Ortiz, she was in our city secretary's office, and through the community challenge, that 3-month community challenge, she was able to lose almost 100 pounds by going to the gym, eating healthy, exercising, and really encouraging her whole department to get involved and all of our city staff. It's been a fundamental part that we place in the workplace as well. This is a program that's 3 months, but it really helps to jumpstart the year and get the gears rolling and moving so that we can continue those healthy patterns going forward. And at the bottom, you see there having healthy meetings as well. Instead of bringing in donuts and a lot of sugary foods and juices, we substituted those out with having water and fresh fruit at our executive team meetings. those department meetings there. Our business community definitely welcomed us with open arms. As you can see, there's a local gym did get involved, and they were offering discounts on their memberships for our residents as well to join the gym. Our businesses got involved, and they as well were able to sign the pledge. And then also in the pledge, it says it allows them to take an assessment on their work and identify what areas they can work towards to make their workplace more healthier. And that includes some things such as brain breaks, and then also evaluating your culture around healthy food in the office and things like that. And we have there at the top, even our Home Depot, they got involved. See them taking a healthy selfie with their orange, but also tracking their steps and incorporating that in their work cultures and their lunch breaks, taking breaks at lunchtime and things like that. And we have at the bottom our Walmart. They were instrumental in donating healthy food for the community for our various different free community health events that we had. One of the events that we would love to highlight is our Couch to 5K that we have in partnership with the It's Time Texas Community Challenge. It includes a 5K run/walk. Our businesses help to donate and sponsor prizes for the community. That includes various different prizes that range from as small as, a yoga mat to as large as George Foreman grill and Fitbits, things like that. And we also have community partners and health vendors that have a table, such as Dallas Health Start, and they work with mothers to set their appointments and then also really helping us identify, make improvements and move the needle in our low birth rates that we're seeing in mothers in our community. So we partner with mothers and help them through the process. Here you'll see a map of our 5K that goes on our beautiful park here. And what you'll see in the 5K walk/run event that we have for the Couch to 5K, our mayor there, he's high-fiving one of our residents there in the pink. We have Cedar Valley College, also out local college students that come out and both walk and also encourage other community members as they're walking. And the diversity we'll see at the event is phenomenal. We have individuals from, we had one person who ran with her 72-year-old father in the 5K run. And it was funny, hearing him talk about his experience in running in the 5K versus in that bottom right-hand corner. I talked with an 11-year-old there with a jacket that was running. He said, "I'm tired." And a 75-year-old told me, "This was great." So shows that age is not a factor. Also in our Couch to 5K, you'll see here again the food that we have during the health fair and Couch to 5K, both the indoor and outdoor event. The food is donated from our local stores here in Lancaster, and then also volunteers, such as the AKAs that were helping to pass out food, and the Foreman grill that was paid for and donated by our local businesses. And we have our gamers there who are out with the healthy selfies to help people take pictures as they're walking, and again, making a commitment for not a one-day event or not a 3-day event or a 3-month event, but to make it a lifestyle. So they were really geared up about that. And we also have our Scout group that came out and volunteered. So there's a Couch to 5K, a story that I would also like to highlight. This is Mari Brock, one of our participants in our Couch to 5K event, and she came out with her father 2 years ago. She was paralyzed in an accident, and it was her first 5K that she was able to run with her dad and brother. She shared her story and helped to motivate others to finish the race. And in 2018, we did receive first place in the It's Time Texas Community Challenge. And the great thing is they also have a college category, and Cedar Valley College, our local college here, also received first place for the 3rd time in a row. Community rallied together, and we received over 1 million points we tied with another city. Together we had over 2 million points. It really showed as a testament to how our entire community came together to make this possible. And the $1,800 health grant, instead of the city taking that and putting it in our departments, we actually donated that $1,800 health grant to a local school, which is the G.W. Carver 6th STEM Learning Center, to be used towards healthy programming in their after-school program. And some of the steps that we have moving forward, our city council continues to make for keeping a healthy, safe, engaged community. We are still expanding our community health initiatives. We have developed a Lancaster market, which is not just a farmer's market, but a community market where they can also come out and learn about programs happening through Cedar College. They can learn about ways to get back in school, and then also learn about resources that are on campus, like the photo below, which is their food pantry that they have. We also talk to residents about our various different trails and resources in the community so that they can keep their healthy lifestyle going. We're expanding and updating our Parks and Open Space Master Plan and improving our Senior Cares Initiative. So we continue, again, to work towards our health disparity issues, and we are partnering with the Best Southwest Partnership. And with that, we're tracking our hospital visits and things like that so that we can see how we're moving the needle in areas such as heart disease. Okay, I think that was right on time. And any questions?
Jasmine, thank you so much, and you're right on time. Appreciate that. But we do have a couple of questions here. Let's start with the one in the room. Angela, this one is for you. The individual is asking about wondering if the diversity of the schools you work with and families of color, especially if those who are non-English speakers, are also involved and aware of the program.
Yeah, so one of our districts that we actually started with and maintained throughout our program is our most diverse in the community, and I can always follow up with additional statistics for that because I can't remember them off the top of my head, but we have a couple English as a second language families, our demographics in that district. So we have a high Burmese population because we've had quite a bit of Burmese resettlements in our community, as well as we also have Spanish-speaking families. And for our program, everything that we do needs to be translated into those languages, which is a little bit difficult with the Burmese population because there are so many dialects, but we work with the schools pretty closely on that, and they're very comfortable getting those things translated for us so that information is going out to those families, and we continue that trying to build those relationships. We also, in that district, have a very high free or reduced lunch rate, and so that is actually a universal school for breakfast, lunch, and dinner available for those families, which in some ways makes it a little bit easier to implement the program, because when we're doing things like breakfast in the classroom, having a universal where you don't have to worry about who's paying, who's not paying, makes that program a little bit easier to, and that goes along with Operation Fit. And it also helps us with when we're identifying additional resources for those schools, because we can use some of these demographics to help with our grant writing, as well as we were able to pilot quite a few things such as the food carts in those districts, just based off of the need in the districts that we work with.
Great, thanks for addressing that, and glad to hear that this is really accessible to a wide range of demographics in your community. You mentioned how you had been able to take this program out into the community with some different community-wide events. And one of our callers had a question about your next steps of, do you have any additional plans for, bringing this outside of the schools and either further involving parents or the larger community?
Yeah, so we're always looking for additional avenues that we can do that. So right now our program really focuses on elementary schools because those are the first, I would say, avenue where it's a little bit easier to implement. Once you get into the middle school and high school, it gets a little bit harder because school schedules are a little bit different and the accessibility to the kids is a little bit different. We've had some high school teachers that have reached out and asked about how to incorporate some other resources to their school, such as we have one school that was looking for gym apparel so that kids had more access to physical education classes because they just didn't have either the right shoes or clothes. So we're working with some community members on how we could get some additional access to those things to take into the school. So we're trying to expand into those higher grades, and then we want to expand, and that really through our partnership with the Y Center, because they are a more recent partner that we've brought into the program through the local Y Center to get out in the community further. So we just had a community event a couple weeks ago where the Operation Fit staff went out and helped with activities that were going on at that community event. And so we look for some more of those partnerships of where we can get out further. And we've had other partners, the city ask us about additional cooking demos. So we're always open to that, and we always look for more of those things as they come up, but it's something that has kind of slowly evolved over time. Sure,
absolutely. And I'm sure with the great success that you have had in schools, there is a lot of interest in wanting to expand that and experience those successes elsewhere as well.
Right. It is fun, though, when you go out in the community. Oh, I was just going to add that it is fun when you go in the community and you see, like, at the local gyms, and you see parents, like, wearing the Operation Fit T-shirts. We do give out quite a few of those Operation Fit T-shirts. So you see it starting to get out into the community more and more. We've actually stopped at different, like restaurants for lunch and had waiters stop us and say, oh, my child loves Operation Fit in the school, and we talk about it all the time. So that is starting to somewhat happen without us having to force it as much as we thought we might need to.
That's excellent. It's having a ripple effect of sorts. Jasmine, I have two questions for you. The first question, I believe, came from the question from the story about the child who was disabled. The caller asked if how you're able to make your community challenges accessible to those individuals with different physical abilities and or low-income families who might not have the same sort of resources to participate in something like this.
Yes. So as you can see, we work hard on making our trails very accessible to all members of our community. That part, there are some trails, these are outdoor trails, are in gated communities, or they might have barriers to entry, but the Couch to 5K Walk/Run event is a great event where we're able to expose the community and residents to parks, trails that they may not have used before or known about. And this is our community park. This is one of the trails that a lot of our residents use. It is very accessible to all members of the community. Again, that hike and bike trail, it expands around the lake, and of course, you can take it in various different variations based on your different ability levels. And so the great thing about how we had it for our Couch to 5K, for 2 laps around, it made it the 5K. However, we had some members that weren't able to do the 2 laps, so they just did 1. And there was various different accommodations that we could make for them so that they can still go and take part in the health fair and or do the second lap around the park, and it was open to all, free and open to the public.
I'm glad to hear that. And then the second question actually came in through the chat, and this is for you again, Jasmine. The question is, where is most of the funding coming from for updating parks and other program improvements, and is there a budget the council dedicates to the community health initiative?
Oh, definitely. So right now, we're in that stage in which we're updating our trails and open space master plan. So that includes different site visits to other open spaces, so trails in the DFW area, and seeing how we can make our trails more connected with other popular trails in the area. And we are completing community meetings and surveys to gather feedback about what our community would like to see improvement-wise in our trails. And then from that feedback, it will all be processed by a company, and they will be able to create a proposal with areas of priority and also additional funding sources that are a possibility to help see those plans come into fruition. And then there was a second question that you asked. Could you repeat it?
Yes. Is there a budget this council dedicates to participation in the community health initiatives?
I think, yes. So the great thing about this community challenge is this is something that is free and there's no cost to participate. So for the community challenge, we do not dedicate a budget to that. It's all through funding from our community, in which we work together to identify sponsors and local businesses. And they sponsor both, again, food for our various different community activities. And then we work with businesses in which, for example, Crescent Medical Center, they put on a free event for the community, which included a blood drive. And we partner with our fire department, our police department, and even the schools to go out and promote the event and also participate. And so various different organizations in the community, such as local churches, will also reach out to us and let us know that they are planning a fair at their church. And then with the beauty of it, we can then partner with them to promote and then also, again, to make sure that that event is a success by bringing in additional resources.
Understood. Great. Well, thank you for that information. I'm glad to hear that participation is not limited due to funding. With that, I did not see any additional questions from the chat, and we are right at the end of our time. So I just want to thank everyone for joining us and being on today's webinar. A special thank you goes out to our speakers, Angela and Jasmine, for taking time out of their busy schedule. The great work and health initiatives that are happening in their communities. We will be having another webinar. It will be September 19th, and we will be focusing on creating a culture of engagement, tools, and practices. For those of you who are interested in applying for the All-America City Awards in 2020, this is going to be a really great webinar for you to jump on because it is all around engagement, which is the main criteria of the application. I will also be sending a follow-up email later today with the recording and slides from today's webinar. I will also be including a brief survey. If you could just take, I think it's 3 questions, about 5 minutes to give us some feedback on today's webinar, any suggestions for ideas for future webinars. And with that, everyone, just please enjoy the rest of your day, and we hope to see you on a webinar again soon.
Thank you all.